This is Dr. David Ting. I practice here in Las Vegas, Nevada. We started practicing here back in 2000, the year 2000. Started my first practice towards the end of 2002, and we've been very blessed, growing ever since. Right now we have 18 locations here in Las Vegas. We're expanding to Northern Cal, Southern Cal, and Northern Arizona, as well as Northern Nevada.
So what's been your business model for that growth and success?
Well, just like all the other dental entrepreneurs, it's through trial and errors mostly. We started, of course, as a solo practitioner and started to recruit associate doctor, implement new technologies and management system, and also incorporating partner in our group. And we've been growing from two model, basically partnership and 100% owned practice run by associate managing doctors.
So talk about what you presented at the conference yesterday.
I was one of the panelists who shared my experience as a dental entrepreneur. We shared about our process, growing pain experiences, basically happiness, joy, tears, and blood, sweat, during the process. That's what we did yesterday.
So what's kind of the biggest secret to success that you shared with the group?
Secret of the success, well, I would never consider myself to be someone who's successful. There are many doctors and entrepreneurs out there who are doing way better than we are right now. So for us, it's a constant learning experience. If I may share what's important to us, interestingly enough, it was also shared by Sally McKenzie yesterday. The number one thing is to realize that we still don't know what we don't know, and so we want to be humble. The second thing I would recommend any doctor who's interested in developing multiple locations or becoming a dental entrepreneur is to learn from the best. Surround yourself from the best. Always constantly looking for anything that you don't know about. As for us, believe it or not, we a lot of time learn from new grads or someone who's in school. We're constantly fascinated by how energetic these new incoming doctors are and how much they know. That's one thing. The second thing that we do is to surround ourselves with the right partner. Partner who can make the proper recommendation as to implementing a structure in your practice, as well as hardware and software. Example I shared yesterday is the conversion to Dentrix Enterprise, which was a long process and also costly. I have to admit, for us it's very costly. But the benefit we get from that, advice we're getting from our partner Kathleen Titus is unbelievable. It's just amazing. And by implementing a structure like that, help us making everything more efficient. So we are now able to monitor our operation from a central location, which is humongous, for group practice, multiple location practices.
Last question for you. In your opinion, where are group practices going? Where is that trend heading?
Oh, I can talk for hours, maybe days regarding this. It is our belief that with the advancement of technology, dentists, or the importance of dentists, dental hygienists, dental professionals, are probably going to plateau at some point and start declining. Like for example, most of the lab work were done by dental lab technician before. Now the trend is machines like E4D and CEREC and all these amazing stuff out there is taking over. 3D printer has become more and more important, and also we live in an age that global. We live not just in this country. We work and associate ourselves with people globally. For our practice, we actually set up offices, business administrative office in the Philippines. So, again, communication is also important. That means a lot of the entry-level position is now taken over by foreign individuals. Most importantly, we know that one day what we are doing every single day, such as filling crowns and extractions, are probably going to be automated. The physicians nowadays are able to do a surgery via robotic arm. That is, someone can operate from Cedars-Sinai on a patient all the way in Ohio, in the middle of nowhere in Wisconsin. How difficult can dentistry be? So we want to prepare ourselves for that day to come, build a good reputation amongst the dentists, so more and more dentists will come sharing the same belief, and so we're joining forces, as well as incorporating technology to help us, not to hamper us, but to help us to do things efficiently. At the end, people will just enjoy the fruits from the harvest from all the hard work we planted today.